Let's stay with this story and look at the role of the United Nations in the fight against AIDS in South Africa. We speak to Nelson Muffuh, UN Resident Coordinator in South Africa. Nelson, thank you so much for your time this evening. Now, according to, the UN's Global AIDS Strategy from 2021 to 26, the aim is to tackle the issue of inequalities to end AIDS. Now, you look at the South African context with glaring inequalities. Has there been any progress made in this regard?
Thank you and good evening, and for having me as well. Yes, there has been some significant progress. We've seen a steep decline in new HIV infections and AIDS-related deaths in South Africa, and this needs to be celebrated. It takes leadership, it takes coordination between government, civil society, vibrant community engagement, international partners, and the UN. Accompanying government's effort to ensure that there's, I think, the largest treatment program in the world for HIV-related illnesses. And really, it is something that needs to be celebrated. Of course, more needs to be done. There's always more that needs to be done. Just before coming on, I was listening in, and the issue of the inequalities with regards to who's infected, girls and women disproportionately than men and boys, also youth, and the need for the uptake in the use of condoms and other treatment and preventive methods. So we celebrate, of course, the efforts of coordination, the deployment of scientific interventions and also treatment, but we are also accompanying the government to try to step up the uptake in this regard.
I'm going to get to the science in just a moment, but I want to stay with something that you just said, and we heard from even the previous interview with Minoshni. Young people simply not using condoms. This is something that is quite worrying. Is it a mindset issue, or is there more at play there?
I think it's a combination of various factors, as always. One of them, of course, still being persistent issues around stigma, and which has to be addressed. Also, meeting young people at their point of need and ensuring that we're really engaging them and talking to them, putting them in the driving seat to craft the messages that are important, to also talk about the package of interventions that would help. So today, for example, and one of the exciting things that we were able to do, and I was able to do, was to attend the pre-conference for young people here in Durban to really, I think, accelerate the effort of engaging young people. And it was good to be there with the Deputy Minister of Basic Education and also the Chief Director in the Department of Health, to talk to young people, to engage them with the co-chair of SANAC and also the chair of the Civil Society Forum, to really engage young people. And it was some vibrant, robust discussions. And I think more and more of this sort of, let's engage with young people, listen to them, give them responsibility to really help shape messaging and interventions that would help take things forward.
How much of a setback would you say was also caused by the COVID-19 pandemic in the fight against AIDS?
I mean, of course, it impacted not only treatment and uptake of that, it impacted young people being at school. It increased significantly, of course, exposure to gender-based violence and risk of HIV/AIDS infection. So we're now, I think, recovering from that. And we hope that the robust measures and the lessons learned from that will help us also be able to apply some of those interventions now to increase the uptake of treatment, to improve the use of technology and science to be able to respond positively.
We spoke about this a little earlier on. Science is evolving, and we saw this even during the COVID-19 pandemic. What can be done in the healthcare sector? How is this also helping when it comes to the advancement of treatment, etc.?
Yes, so I mean, today at the exhibition here, which I visited, one could clearly see how the scientific interventions, the lessons learned with regards to testing, tracking and tracing, with the deployment and distribution of medication, with the strengthening of health systems, that I think is really something that we really need to take forward. And this is coming quite strongly through in the discussions and presentations that are already unfolding right here at the conference.
As a final question, then, it's very easy to be overwhelmed by the statistics that we're seeing, by all of this that is coming out and the analysis around this particular subject. But would you say there's still hope, though, that the world will overcome?
Certainly. I am actually a glass half full person. The UN works also to try to bring hope where there's despair. And yes, with the progress that we're seeing, and the significant, like I said, steep decrease in terms of new infections and also deaths related to HIV/AIDS, coupled with South Africa's incoming national health insurance bill, and also the interventions around financing, but also science and engagement with young people, we can definitely hope that there's going to be some significant progress in the coming months and years.
Nelson, appreciate your time. I know we stole you from a session, but thank you for coming out for us. Do appreciate it. That was Nelson Muffuh, UN Resident Coordinator in South Africa.